We begin with what they're now calling a slow but solid trending down in South Florida COVID cases.
And one of the first and best signs of that trend are falling numbers of hospital admissions in South Florida. They're on the way down, happening across the Jackson Health System, South Florida's largest public hospital system. Joining us now is the CEO, Carlos Migoya. Carlos, good morning.
Good morning.
Great to see you.
Good morning, guys. How are you this morning?
We're doing well. So tell us, what is happening with admissions and discharges from the Jackson Health System?
Well, admissions are dramatically down. We are less than half of what we were at peak. We were running at one point 60, 70 patients a day that we were admitting. We're down in the mid to low 20s at this point. And the discharges are exceeding those numbers. So that's why, if you look at the peak of where we were back in the middle of July, we're actually 48% down from that number, almost half exactly. The ICU beds are not as reducing as fast. They never do. It's a laggard situation. Obviously, the sicker people take a while longer to go through the process, but we're down a third in our ICU beds also for our COVID patients. So the trends are there, and they're very solid. Also, people coming into the ED, to the emergency rooms, have reduced as well. We went from having 75 positive COVID patients a day during the peak now to averaging somewhere around 15.
Carlos,
so if you can see people in Glenna, the numbers are well down.
Yeah, and when we spoke earlier this week, you had mentioned you're in regular contact with other counterparts, other CEOs in hospitals across the county. So this, the public hospital we're focusing right here, but this is a trend county-wide. What do you attribute that to?
Mm-hmm.
Well, this is a trend South Florida-wide. The calls we were on, Glenna, you're exactly right. It's Dade, Broward, and Palm Beach. We believe the aggressiveness that was taken in early July of doing the curfew, of reducing the visits in restaurants to outside, and some of the and not only that, but also the social distancing and masking that people, even though it's not 100%, it's a lot better than it used to be. It really has actually had a very positive reduction. I mean, yesterday's numbers in hospitalized beds for the county, we were in the 1,300 range. From the max of 2,300. So all of those numbers are really positive. And now we have 2 straight days of slightly over 10% positivity rates on tests of 14,000 tests a day.
Yeah, Carlos, let me ask you about admitting children, or who your doctors are seeing kids, because there's kind of an alarming statistic that we came across. 219 cases in Miami-Dade in the last 2 weeks of children being diagnosed with this, and a positivity rate of 18.8% in Miami-Dade, 119 kids in Broward, positivity rate of 15%. Are you seeing those kids? And just from your opinion as a hospital administrator, what about kids going back to school when there is still the rate of positivity and number of children getting sick?
Well, you bring a great point, and then obviously when you say children getting sick, it's a relative term. Our census is that right now is running around 10 children, and it's never gone higher than 12 or 13 children that we have had hospitalized at any one time that are positive of COVID. It's not so much that they get so sick that they get hospitalized, but they do have a positive. They do turn positive, and the question still out there is at what age and when do they infect other people? So it's not necessarily just the children getting sick, it's how they can then infect other people.
Right.
And when they're at school, they're not infecting them, not only infecting themselves, they're going to infect the adults in the schools, and then they come home and infect their parents or grandparents. And that's a challenge. That is a challenge.
We're talking about what is a positive trend, positive meaning good, finally, a positive trend for South Florida. But we really need to talk about the number of fatal cases and the death rate. Those numbers have really been up and alarming lately. And I'd like for you to put in context those numbers, because that's the number we're going to see go down last.
Yeah, you're unfortunately right. When I mentioned to you that the intensive care beds do not come down as fast, obviously people in intensive care have a higher mortality rate than those in a med surge. and typically even higher mortality rates for those that get ventilated. And unfortunately, those are the cases. We've seen in Miami-Dade a slight improvement of vented patients from COVID than we did in New York, but it's still a very high mortality rate. So from that standpoint, you're right, Glenn. We're probably at least a week or 2 weeks from seeing the peak of those numbers. So the numbers will continue to be high in mortality, and the death rate will climb because obviously, as you have less people being admitted and more people dying, that's unfortunately not a positive thing. And many of them have a lot of comorbidities. It's the same exact challenge, but we will see a lot of those numbers continue to climb here for the next week or two.
Right. In Florida yesterday, 204 deaths were reported from COVID-19. Carlos, let me ask you kind of a housekeeping issue. 4, 5, 6 weeks ago, when your hospital was really under the gun, you asked the governor for help. He sent in dozens of nurses, respiratory therapists, other people to help out. Do you still have those people, or have you sent them home?
So we have some of them still in. I just talked to the emergency management director, Moskowitz, for the state on Friday. We will no longer need any but the physical therapist by August 21st, which will be this coming week. They've been a great help to us, and not only in the climbing numbers, but also as a relief of our own employees that have been at this for well in excess of 5 months. So we will see some respiratory therapists beyond August 21st, but the nurses, intensive care, and a lot of the other ones will be going home. And from our standpoint, and correct you slightly, Michael, it's been hundreds, not just dozens. So they've been a great help to us.
So real quickly, Carlos, sort of speak to the financial viability now, which all hospitals have really taken a hit with this pandemic. Some have started up elective surgeries again. That is something that is very important to the revenue of the hospital. Jackson has not, right? Do you expect to do that soon?
We're looking to start some of the outpatient surgeries this coming week. As we've had now a lot of the nurses that work typically in operating rooms being able to go back to operating rooms. So we will start doing outpatients and some of the lower ICU use cases this week. And that's the beginning of gearing up. We hope to be able to gear up in the next 2 to 3 weeks. And it's important for everybody to know, not just at Jackson, but every hospital, we have isolated COVID patients from non-COVID patients. So anyone that goes in for any kind of electives, and a lot of people have deferred their electives for way too long at this point in time, they should feel very safe in coming in and getting their procedure done at any time.
Carlos Migoya, CEO at Jackson Health System. Carlos, it's always good to speak with you. Thank you for the very good work that you and your staff have done over the last several months.
Thank you.